nephrologist from Toronto, Canada. I'm an active member of the International Society of Nephrology Education and Social Media team. I'm extremely honored to have with me today Professor Bernardo Moguel Gonzalez. He is the Chief of Interventional Nephrology Service at Instituto Nacional de Cardiología Ignacio Chávez, Mexico City in Mexico. And he's the past president of IMIN. He is the liaison officer of the Interventional Nephrology Fellowship Program, ISN Mexico. He's also a member of the ISN Interventional Nephrology Working Group. It is our immense pleasure to have him here today with us. His immense work in the field of interventional nephrology, his research, awards, and accolades precede his reputation. A very warm welcome to you, Dr. Moguel Gonzalez. It's again a great privilege to have you here today.
Thank you, Suman, for amazing introduction, and thank you, Fernanda, and all the nephrology community from the ISN and the World Congress of Nephrology. I'm really excited to be here and be part of this program and this opportunity to introduce more about the interventional nephrology. Thank you very much, Suman.
Perfect. Well, with WCN 2024 just around the corner in April, we are all excited. And you being one of the speakers there, how do you feel about it?
Well, honestly, excited and worried about that, but I think it's a great opportunity, and I will say you a great responsibility, because every year the interventional nephrology is getting more people interested in that. And this year, of course, is important for us because now it's a part of the program, and I will say you a very important titles of these topics and this part of this program to not only introduce, to expand the knowledge of interventional nephrology. And absolutely, Suman, I think the World Congress of Nephrology is a highlight of the year for many of us and all the nephrology community. And it's not just an opportunity for me and for all of us to share our work and to learn from others, but also I think it's a great chance to connect with the peers from other around of the globe, not only from my country, for my continent, from around the globe. And particularly excited to present our latest findings and to discuss the advance in interventional nephrology. I think it's an honor to be part of this great and significant event for me. I think, well, I think that's the main message and how I feel it about the World Congress for this year.
Well, that's great. That is very inspiring to most of us. And I'm sure there are a lot of young professionals listening to this as well. And I'm pretty sure what you said and what you will say in this interview will inspire more of us to get involved more with ISN, more with nephrology, and what you do, interventional nephrology as well. Well, before we talk about your upcoming presentation at WCN, we are interested in knowing what drew your attention and you towards interventional nephrology particularly.
Well, this question could have 3 or more answers, because it's right now it's very complex what is going on with the nephrology. I could tell you that right now, I think we are living an identified crisis in the specialty, because the traditional nephrologist should be performing or should be master at the end of the training in about 15 procedures when they completed all the training. And they continue performing the procedure during the professional life. But right now, you can see some surveillance that 26% of the fellows feel that they don't have enough procedures, and that's okay, and that's secondary to the many programs. They are not performing any procedures during the training. Actually, some countries, they never get any kidney biopsy by the fellows during the training, or placement of any catheter, emergency catheter for hemodialysis. And I think this is mandatory for any general nephrologist. So if we can change this kind of training, I'm sure that the nephrology is gonna be back as one of the most attractive subspecialties of the internal medicine, and that's why all the new fellows could get to the nephrology. And also for the interventional nephrology, I think we have a very special mission, because one of my most important interests is sparking this dynamic nature and profound impact in the patient's lives. As you can see, many different subspecialties in the nephrology, for example, who is working with the glomerular disease, they have to perform with huge many um, patients, and they will see the response for the different novel treatments, maybe for 1 month, 3 months, or 1 year of follow-up. And when you are getting the procedures, you will get this response to your procedures instantly. And I think that's one of the most satisfactory parts of the interventional nephrology when you compare with different areas from the nephrology, because this subspecialty blends a technical skill with core principles of nephrology, allowing us to the minimal invasive treatments for complex conditions and the possibility to directly improve the patient's outcomes and quality of life through these procedures. And we are working now, breaking some paradigms for conditions where the procedures could not be performed or should not be performed, because right now, with the new technologies, this could change. For example, the kidney biopsy in small kidneys, or the elderly people, the performing the tunnel catheter without fluoroscopy, only with ultrasound, because in our countries we don't have all the supplies at different countries. Also, the kidney biopsy during the pregnancy. This could consider terrifying for the old nephrologists, but right now it's our reality, and we can make these procedures safely with the correct training. And I think the most important objective and why I love it, the interventional nephrology.
Well, that is a lot of great information. And what you just said right now, it just seems like you're very passionate about your work. And so should everybody be passionate about their work. And you're right. Nephrology is a different part of internal medicine where you have, the thinking aspect of it. You can do hands-on procedural things, and it is becoming a lost art. Like, people are losing that inclination towards it. People are losing their competence in it because they're not doing as much. And you're very right about it. It is one of the hot topics actually throughout, I think, across most of the nephrology societies across the world. And well, I'm glad that you touched upon it. And it's very interesting about, performing the biopsies on pregnant patients and things like that. Those are actually horrifying to most nephrologists. They don't even consider it. And even they won't even, refer that patient to an intervention nephrologist either, because or an intervention radiologist to that fact. So these are very important topics. They're so excited about all of these things that are going to come up. Could you tell our audience something about the ISN's intervention nephrology program? You're very much involved in that too.
Yes. Well, for this year, I think the ISN Interventional Nephrology Program, it's an incredible initiative to aims to enhance the skills and knowledge for the nephrologists in the field of interventional techniques by providing the training resources and different platforms for exchange of the best practice. I think the program seeks to elevate the standard of care for the patients worldwide. And being part of this program has been immensely rewarding for me, and the passion for education or educating, and my commitment for the advancing in this field. I think that's why you feel that passion for doing this. And one of the most difficult challenge that we'll have as an interventional nephrologist is how you transmit and how you train your fellows with these different skills. And of course, it has to be hands-on. And all the time, I could tell you that this is go back to the old school. The only way you can really learn interventional nephrology is like in the old days, with your mentor beside with you, hand to hand, doing the procedures, and that's the secret of training a great future interventional nephrologist. For example, now we are training from the ISN 12 different nephrologists. They are now interventional nephrologists from different parts of the world. Actually, I have one from Philippines. It was a great experience to have in Mexico one Philippine with the language, and he at the end learned interventional nephrology and a kind of language from Philippine and Spanish. It was a great adventure for all of us here from Bolivia, Ecuador, Argentina, Mexico, El Salvador, different parts of the world. They came here, and also from the local nephrologist. And I think the only way you can grow up is like this. Now, how can any nephrologist from Philippines, for example, know about him, know about me? There is because he returned to the places and make the difference. And I think that's the great impact with the ISN and the works with all the fellowships, and how they gonna be a center of formation in every these countries, and that's the only way to expand the knowledge and I could tell you the high quality knowledge in the future.
That's most definitely, yes. And it's a knowledge transfer, cultural exchange, all of it together. But I'm glad ISN is such a platform that provides this to be like it makes it possible. It would not have been possible without such a platform. It's again great work on everyone's behalf, including interventional nephrologists, ISN, sister centers, all of it. But it's all really good. Well, all of this makes me really eagerly wait for WCN, but I'm very curious about interventional nephrology session. And if you could just spare us a little glimpse of it, I know you can't give us the whole detail of it, but can you spare us a small, just a sneak peek into your session?
Yes, my boss and my mentor says that the interventional nephrology is a small part of science and the rest is the showman. So why is that? Because this session is gonna be more than I'm gonna share how we are working with our fellowships in our center, how is the benefits of you choose, for example, the Mexico as a local training center, because you can perform all the procedures without any specific license, because that's a great barrier around the world in different parts, because they get there and they, at the end of the training, they only be an observership. And please, let me tell you, if you consider you're going to be interventional nephrologist only observing the procedures, it's not going to be enough when you go back to your place and you try to perform this. So I think this is going to be the most benefits of being in this kind of countries, and that's the reason why the ISN are supporting a lot of these areas in these countries, and of course our center. We are working with different results, and I want to close this question with this part. When you get to an interventional nephrology center, you are not getting only the procedures. You are getting a center of research in the field. If you get that in your mind, you are not only training in the procedures, and you're also training for research in all this field. That it's a huge information all days doing this part.
Well, that's truly incredible and very inspiring. Thank you so much for all the information that you provided to us today. And we look forward to diving into this more at WCN 2024 in April in Buenos Aires. And the session is on Sunday, April 14th from 3 p.m. to 4 p.m. local time. Don't miss it. Well, thank you so much for your time, Dr. Moguel Gonzalez, and we're eagerly looking forward to meeting you there.
Of course, man, and of course I'm gonna meet you there, and we were very excited to share all these things I already told you to all the nephrology community in the World Congress of Nephrology.
Well, thank you so much. Stay tuned for more fun and exciting updates from ISN and WCN.